So you're a health conscious individual who's been told that statins are the only way to manage your high cholesterol. But now you're dealing with things like fatigue and muscle pain, and you're wondering, is it really worth it? Is this the only way to manage my cholesterol, and is it even good for me? Maybe you're just confused about all of the information out there and the advice that you're getting. Maybe it conflicts with the way that you're really feeling about how it's affecting your health. I understand not wanting to use medications to manage health, especially if they don't make you feel well. Well, in today's video, I am going to talk to you about how statins work, how they work to reduce cholesterol, but also how they put you at an increased risk for a cardiovascular event if we're not managing the underlying conditions, which are generally inflammatory in nature. That way you can experience balanced energy and hormones without having to rely on a cocktail of medications that don't make you feel good. Welcome back to my channel, where I help you manage dis-ease in your body without using medications. My name is Dr. Artz. Let's get started. All right, let's start with the basics. So statins help to inhibit an enzyme called HMG-CoA reductase, which is involved in the pathway of making cholesterol. The problem is HMG-CoA reductase is also involved in creating something called CoQ10. So when you take a statin, you end up depleting not only your cholesterol, but also this important molecule that is a part of the cell cycle that creates energy, or ATP. This obviously has many downstream implications. We need ATP for our cells in order to prompt them to do their functions. So when you block this pathway, you are not only lowering your cholesterol, but you're depleting your energy supply. This ends up leading to a lot of muscle cramping and the depletion of nutrients that you wouldn't think about, like B vitamins. B vitamins are essential to liver detoxification pathways, which are also activation pathways for things like hormones, including steroid hormones like testosterone, estrogen, and progesterone, cortisol as well, which are all going to act as very important anti-inflammatories. Since the root cause of elevated cholesterol is very rarely genetic, we have to consider the effect that inflammation has on our arteries and our liver's production of cholesterol. Now, your labs and your doctor may say that your cholesterol is high. I want you to do a quick calculation, and then you can decide whether you actually need to go on a drug for this, or if we can manage it from a root cause perspective instead. If you take your total cholesterol and you divide it by HDL, you'll get what we call a cholesterol ratio. Now, a lot of labs will have a cholesterol ratio already listed there for you. Unfortunately, the reference range for that tends to be anywhere from below a 5 to below a 4. We actually want to see a cholesterol below a 3.0. That leaves us room for fluctuations in cholesterol, which will happen in response to transient inflammation. What the cholesterol ratio is actually looking at is what is the ratio of your good to bad cholesterol. Now, LDL is not bad cholesterol, so let's talk about what it does. LDL is reparative. Its function is actually to repair microtears on the inside of our arteries. These happen for a variety of reasons. We get them from inflammation, from high blood sugar, from high blood pressure, from food sensitivities, from oxidative processes due to environmental toxins. And these are things that we're exposed to on a daily basis. So if we ignore the root cause of where cholesterol is coming from, and we just try to get it as low as we possibly can, then we're not considering the fact that we've left our arteries at an increased risk for a cardiovascular event. So a cholesterol ratio is looking at how high is your LDL in relationship to your HDL. And the reason why that matters is because HDL's entire responsibility is to clear LDL plaques away from your arteries. As long as we have a balanced ratio between those two, you do not have high cholesterol and you do not need to go on a statin drug. Now, LDL cholesterol isn't just about repairing your arteries. LDL is also the precursor to our steroid hormones, like I mentioned earlier. We need to make sure we have enough LDL cholesterol to produce things like testosterone and estrogen and progesterone and cortisol. Statins can actually put you at an increased risk for a cardiovascular event. So let me explain to you why that happens. If we lower your LDL cholesterol with a statin, we've also lowered your HDL cholesterol at the exact same rate. So when we're talking about ratio, the ratio doesn't change when we put you on a statin. Instead, we've only taken away your body's natural ability to repair itself and done nothing about the underlying cause. that puts you at a high risk of having something like a stroke or a heart attack or LDL plaques in general. That's because the inflammatory process, wherever it's coming from, is still there. So statins can actually be really dangerous for people, not just giving you poor side effects on the outside, but causing more damage on the inside. You may be asking yourself, why doesn't my doctor know this? Why didn't my doctor explain to me about cholesterol ratio? Let's talk a little bit about reference ranges and what your doctor has been taught to do. So first and foremost, when your doctor goes to medical school, which by the way are funded by pharmaceutical companies, they learn how to prescribe medications based off of lab reference ranges. Lab reference ranges, and you're going to hear me preach about this a million times, they are not normal ranges. Lab reference ranges are averages created by the lab, and they vary on a day-to-day basis, not only from the same lab, but different labs will have entirely different reference ranges. So your doctors have been taught to look at whatever is outside of a lab reference range and prescribe based off of that. They're not taught to be critical thinkers. They also don't receive any training as far as diet and lifestyle goes. So they may tell you, hey, cut back on the fats and exercise more. But in fact, cholesterol actually comes from sugar. So unless they're telling you to fast and increase your fiber intake and decrease your carbohydrates and sugar, the dietary advice you're getting is probably pretty basic. Exercise, particularly HIIT exercises, are actually the most effective type of exercise for reducing cholesterol. And that is because of the latent burn they have with not only fat, but also sugar. Your doctor may also not want to tell you not to go on a statin because it puts them at an increased risk of liability. At least they've covered their bases if they give you the drug that the lab says they should. This is one of the reasons why I don't take insurance with my patients. That way I can treat you the way that you deserve to be treated, and I don't have to prove anything to the insurance companies. Which reminds me, be sure to watch my next video where I go into this topic in further detail. Click the video that's on your screen right now, and I'll see you there.